Voilà, là, nous deuxième étant bienvenue de notre Topik Konversasyon. Et pareil, un petit peu tout plus bonheur. Aujourd'hui, nous posons Dr. Suganya qui nous propose les conditions qui, si madame est familier avec les conditions qui en a, qui peut souffrir avec ici Cécile. Et aujourd'hui, nous pouvons nous un petit peu l'éclairage de sa situation, qui est bon traitement, qui est capable de gagner, qui est accessible pour ou capable de réduire un petit peu les conforts et douleurs qui viennent avec sa situation. Mais entre-temps, avant d'aller dans tout ça, là, nous besoin welcome nos guests aujourd'hui bon matin. Dr. Suganya, good morning. How are you this morning?
Bonjour.
Bonjour.
Mo bien merci.
Ou bien merci, mon remarque. Ou bien merci. Happy Diwali to you.
Thank you.
And to your family as well.
Merci beaucoup.
Merci. Et aussi, just to go into our interview this morning, yes. I just want you to pronounce this for me. Is it Menorrhagia?
Menorrhagia.
Menorrhagia. Okay, so it's menorrhagia is the condition we're going to talk about this morning. Yes. So if you can enlighten us, what is it exactly?
Menorrhagia is a condition where you have heavy bleeding.
Okay.
It's your period is very heavy.
Okay.
Where you change your napkins almost 5 to 6 times a day.
Okay.
And the napkin is full. Right. It is not half soaked, it is fully soaked.
Okay.
And the period stays for long duration, say it crosses more than 5 to 7 days.
And okay, so let's break this down right now. Just from this introduction that you've given us, already I have so many questions. Now, you've said more than 7 days.
Yes.
What is considered to be a normal period time frame for any woman who's experiencing their period?
The normal time for a period for any woman should be ranging from 3 to 5 days.
3 to 5 days.
Anything more than 5 days,
okay,
it's an alarm.
Okay.
If it is more than 7 days, for sure, the person has to go for a gynae checkup.
Okay, all right. Donc voilà, mesdames et messieurs, 3 à 5 jours, normalement, les temps qui sont supposés gagner règle. Et pas là 5 jours, pas là 7 jours, il y a un problème. Plus que 7 jours, définitivement, ou besoin de mettre un appointment pour aller voir docteur. Alors, so, c'est un petit peu qui nous supposé pour cause de là aujourd'hui. And I like how you said the flow is heavy, but being a woman, we're curious to know 67 pads per day. How many should we be saying? Oh, okay. First of all, you just mentioned that 3 to 5 days is the normal time frame. But how often should a woman be changing her sanitary towels during the day?
That's a very, very good question, Salvi.
Okay.
Because a woman should ideally change her napkin every 4 hours.
Every 4 hours?
Every 4 hours.
Okay.
All right? And if the pad, even if it is soaked or not soaked, the pad has to be changed.
Yeah.
Because it helps in her personal hygiene.
Okay.
Blood is a culture media.
Okay.
It attracts a lot of germs.
Okay.
Even if she is bleeding normally, the change of napkins, pads, should be every 4 hours.
Okay.
And when she notices the pad is full and she changes every 4 hours and it is more than 7 pads soaked fully, then it is heavy menstrual bleeding.
And we should be visiting the doctor.
Compulsory.
Now, what happens when it comes with pain?
Very, very serious. Because the pain perception differs from person to person. For one person, she can be tolerable to minimum amount of pain, even to maximum amount of she can be very strong.
Okay.
She can tolerate so much pain. She can still go to work.
Okay.
But when the pain radiates from back to the front and passes to the legs, then it is condition has to be attended because this pain is not normal. Because when the period is heavy, the uterus is congested inside. there is a lot of blood vessels that is congested
Okay.
and constricted. The blood flow is reduced, so the cramps happen and the pain is very severe.
Okay.
Mild pain, yes, it's normal to have minimum discomfort during a period
Okay.
for the first 2 days.
Yeah.
But when the cramps are very severe and if it is radiating to the legs and associated with other symptoms like vomiting,
Yes.
and severe back pain,
Migraine.
yes, migraine, then compulsory she needs to inform her gynae and look into what is happening inside her.
Okay, ladies and gentlemen, mesdames et messieurs, mon compte a dit, bien messieurs aussi, because it's important to bring the men on board as well. Know your woman. I like how I'm bringing the guys on board, but I'm not really saying what role can a gentleman play in this situation. The woman is suffering. Clearly, we know that.
Yes.
What role or what should a guy know during this time on how to behave and act around the way? Because our hormones are all over the place when we're menstruating.
Yes.
Yes.
The partner
Yes.
or the male the friend or
Yeah.
whoever usually is under the impression that this period is normal for any woman.
Okay.
Why all the fuss? Why all the cramps?
Yeah.
Why all of a sudden? But
You've been through childbirth. You should be all right with this. It should be a walk in the park. No, it's not.
yes, it is not, because the woman undergoes huge mood swings
Yes.
because of the hormones.
Okay.
There is a huge shift in her hormones
Yeah.
inside her body. So the gentleman should understand she is bleeding, she might have discomfort, and she has the mood swings.
Yes.
It's better to give some moral support
Yeah.
and understand her. And if the gentleman notices her frequently changing her napkins, then at least the gentleman can insist,
Yeah.
it's time to visit the gynae.
Okay. How often should a woman visit the gynae, doctor?
The moment the girl attains menarche or notices her first period,
Okay.
that is step one.
All right.
She should make a visit to her gynae and see whether the period is normal, because nowadays the girls see their first period very early,
Okay.
like the age of 10 to 12 years. That is very early.
And is it okay, or should we be worried?
This is a huge change in the lifestyle modification that it has inculcated and passed on to the girls.
Okay.
We should really be worried, because the girls are exposed to too many junk foods, like the chicken burger, the arid carbonated drinks, and above all, the media. The constant screen watching time, if it is more, then it disturbs her hormones inside.
Okay.
And all this changes the normal regular hormonal swing that is happening.
Okay.
And it shifts, reverses, and makes her see her first period even at the age of 10.
I like how everything is interlinked. We try as much as possible to segregate things, but at the end of the day, when we look at it, it's all interlinked.
It's
all interlinked, doctor. I've got one question from a lady. She's texting. Thank you for your question. Good morning, Sylvia and doctor. I'm 47 years old and have my period when I was I have my period, for only 2 days. Is it normal? She's 47. She's experiencing her period only 2 days per month. Is that all right? Because we have to bring in another word now.
Yes.
Menopause.
Yes.
Oh,
It
premenopause?
is. Yes.
Yes, okay.
At the age after 45 years,
Yeah.
the ladies, the hormone level comes down slowly.
Okay.
After the 45 year,
Yeah.
you can see there is a change in the menstrual flow.
And a change
For
in
some.
personalities as well? Doctor?
Yes, her voice can become hoarse, there is severe mood swings, night sweats, too many irritation, and weight gain.
Ah,
And above all, the breast can feel very heavy and flabby.
Okay.
All this because the muscles lose their tensile strength. The skin loses its the texture and becomes very elastic. And noticing the period, coming to her question, for only 2 days, it is perimenopausal.
Okay.
And she can expect her periods to slowly come down from 2 to 1 and then stop.
Okay.
By the age of 50, that is the menopause.
Yeah.
And if she doesn't notice her period for 6 consecutive months, then we can make sure that she is for sure in the perimenopause and menopause.
Should she come to the doctor, just to be on the safe side?
Yes.
Okay.
All women after the age of 45 years, when they notice a change in the menstrual flow, it's definite they visit the doctor, because for some, the hormone goes down and all of a sudden after 2 months she can throw heavy bleeding. Then she might be very afraid, thinking it is cancer. No, it is not cancer. It is the perimenopausal hormonal change that is changing her menstrual flow.
I have a question that came in as well. Good morning. Is there any is there any treatment for such a condition as menorrhagia?
Yes, there is treatment.
Yes.
Now with advanced technologies and science development, we have enormous treatment for this heavy menstrual bleeding, starting from analyzing what is the problem. You see, the problem for heavy menstrual bleeding can be even a miscarriage, a missed miscarriage. The woman would not have known she is pregnant, and she is passing clots for more than 10 days or more even. When you do an ultrasonography, you find something inside her uterus. And then when the gynae checks her urine card test or a pregnancy card test, then it shows all 2 lines, but it is not very dark pink. So this is the first sign telling that she is undergoing miscarriage. The treatment is entirely different.
Okay. So let me ask this. Are women with menorrhagia prone to miscarriage?
No, it is not like that.
Okay.
It is the miscarriage is prone for menorrhagia.
Okay.
It is a reversal.
Ah.
The miscarriage, if she is bleeding heavily and if she is in her fertile age group, then the first thing that should strike is she might be pregnant. Even if she has crossed her day, even by a single day. There are every chances that she is pregnant and she has had a miscarriage and she is bleeding heavily.
Yeah. All right. Merci pour ça, mesdames et messieurs. Vous avez quelques questions? Dès 88-89 pour madame qui a envie demande sa bonne question. Pour ou qui peut expérience douleur, pour ou qui peut expérience ou les temps règles, plus qui se dit, docteur Indy, il est important pour passer côté li, il y a venu, tout à fait, of course, un revue et pour regarder qui ont différentes options qui sont capables de gagner accessible avec pour traiter sa condition. Now, what are signs that we're losing too much weight? We mentioned your sanitary towels are overflowing, more than 6 napkins. Now, what are some of the other symptoms that comes with this condition?
All right, she can pass some clots.
Okay.
The clots just stay on the napkin and doesn't get inside her napkin, doesn't get filtered. Or when she goes when she passes pee and then she sees a clot falling inside, then it is definite that it is her heavy period. And she is very tired, she is very exhausted, having no energy. She can become anemic. The symptoms of anemia can show up. She feels very tired and weak. These are the other symptoms because of heavy menstrual bleeding or menorrhagia, as you put through.
Now, how a lot of women perhaps go from one spectrum to the other in terms of the condition itself. Now, how do we know for sure that this is this condition?
She should maintain a menstrual calendar.
Okay.
This is step one.
Yeah.
Every woman should have her menstrual calendar maintained. Then she notices a change from her previous menstrual pattern, and then all of a sudden she sees a gradual increase in the number of days, the number of napkins changed, passage of clots, increased abdominal cramps, and increased body weakness, mood swings. Then it says she has this heavy menstrual bleeding and she should visit the gynae. Believe me, Sally, when I come to Seychelles every month and almost every day, I see of the 90% of the women walking inside my chamber only with the complaints of heavy menstrual bleeding or altered menstrual flow. And when I ask for them, please show me the menstrual calendar so that I can have an idea what is the previous cycle, then they say, no, I don't have it. So it is like I'm educating them to have a menstrual calendar followed at least for 3 months. So it's easy for the gynae to understand the hormonal swing happening.
I've got a gentleman who's entered the conversation, and he's curious to say, hi, listening to you two talking about that heavy bleeding. Just out of curiosity, am I right to insinuate that this blood, so to speak, has nothing to do with a normal circulatory system, like when one's got a cut?
All right.
Doctor?
The gentleman is curious whether this bleeding is because of injury.
Yes.
And I think, to be more precise, I think the question is associated with sexual activity.
Okay.
A vigorous sexual activity causing bleeding, how to differentiate?
Yes.
Because nobody is going to cut inside. Right.
We should hope not.
Yes.
Please don't try this at home.
It is.
I mean, we might have a doctor, but we don't want this to happen. Okay.
Yes.
Moving on.
The cut or injuries, like even a bicycle or accidental fall, the color of the blood is bright red, and it just flows, and you can see the bleeding. And when she visits the gynae, the gynae can notice whether this is her period or whether it is because of the injury, because all you can see, the vagina shows all by itself. There is some injurious area that is bleeding because of vigorous sexual activity, because of accidental fall, because of a bicycle injury, everything, any kind of injury for that sake. The vagina examination reveals there is this sign where...
So you would know the difference?
For definite.
Okay.
And it is good the gentleman put forth this question because many women mistake that it is the period.
Okay.
Because after the sex they can see some bleeding and they misunderstand it is her normal period, which is not so.
So do not confuse the two. Now, I've got one question that came in. Hi, good morning. I'm a Seychelles student in another country. I was diagnosed with Turner syndrome, which has an effect on the hormone system. Can the doctor explain it a bit? I know it's not in our topic today.
What is the syndrome, sorry?
Turner syndrome.
Turner's. All right. This Turner syndrome, she definitely has to visit the endocrinologist and the gynecologist.
Okay.
Because it is a genetic difference that has happened inside her body. And it is a chamber where the girl has to undergo a huge number of evaluation, the hormonal pattern, and women with Turner syndrome, they can have very late menstrual onset.
Okay.
That is the first factor, and all the external features of Turner syndrome can be seen when the lady walks inside the chamber. It's a teamwork.
Okay. Voilà. I hope we answered your question. 289 is the number to call. Doctor, is this this condition that we are talking about today, is it hereditary?
The menorrhagia?
Yes.
No, it is a part if the mother has got heavy menstrual bleeding, there is every chance the daughter can also experience, because
Yes.
understand here, the mother might have got the tendency for fibroids or the other condition called adenomyosis, where the uterus is swollen or enlarged. This condition can be passed on, and the daughter can experience heavy menstrual bleeding. It is not hereditary, but the fibroids can be transmitted from mother, from grandmother to the daughter.
I've got an interesting question this morning. Good morning, doctor. My question is about contraceptive pills. Is it okay for a woman to take it every day? But can I add on to that? Can contraceptives affect our menstrual cycle to actually cause?
Yes. Good morning to her. Say hi. Yes, these contraceptive pills, if it is taken daily, it definitely affects the hormone.
Okay.
Because we all know these contraceptive pills are nothing but hormones.
Yeah.
So when you take exogenous, like hormones from outside, and alter the normal hormonal pattern that is running inside, it definitely can cause a difference in the menstrual flow.
Okay.
Because even if she misses taking the pill for a day, then the pattern goes, the hormone dips, and she can say heavy menstrual bleeding. And it is not good for any lady to take contraceptive pills for a long duration.
What is your definition of long duration? What is the time frame that we should be on the pills?
See,
or any contraceptive whatsoever?
Yes, there are many contraceptives available. I'm only asking the women not to go for pills for more than 3 to 6 months. After 3 to 6 months, I ask every lady to give their body a recovery period for at least 3 months.
But we've had ladies on the pills for like years.
That is what I'm seeing here in Seychelles, and it worries me. You see, a lot of oral contraceptives taken for very long duration, for years together, can affect the reproductive system, like the uterus, the ovaries, the breast. So, I need to throw some advice here about the other contraceptive methods available, like not the pills. There are contraceptive devices, the latest. It is like an umbrella, and it can be placed. It is non-hormonal, and she can have it inside her uterus for any number of years, ranging from 5 to 7 years. And then, when she wishes to become pregnant, she can remove the device, and then she can reverse her pregnancy.
Recently, we've seen implants available in Seychelles for women. Are they similar to the contraceptive pills, and should they not be used for more? Yes,
the subdermal implant that is put inside her arm. Yes, they are hormones, because these hormones send a spike, or every month they release a spike of hormones inside the body. And I can see it at Dr. Murthy's. I'm seeing the patients with implants where they experience a huge sudden change in their menstrual flow, and they want to remove it, because all implants doesn't work for every woman, and all body composition is not the same. So it is always good to have a contraceptive advice with the gynae, and then go for a choice available ranging from pills to implants to contraceptive device to the most commonly available barrier condoms. It's easy, the gentleman can cooperate, and then using condoms, and then the lady can recover from using the pills. Yeah. The body can recover.
So it's okay to switch, doctor?
Yes, it's very much okay.
You recommend to switch?
Yes, I very strongly recommend.
Okay.
Don't take contraceptive pills for years together. I have seen women not seeing their period because they continuously take the contraceptive pills. Yeah. And especially the morning after pill.
Okay. Yeah.
Because
we talked about that last time.
Yes, because of the unprotected sex.
Yeah.
So, I don't recommend contraceptive pills for years together. 3 to 6 months is okay, and then give a break. Okay. Go for alternative.
All right, I've got one question. When you reach menopause, would the feelings still be the same, even though we are not bleeding?
Yes.
Can we experience cramps? Can we experience the pain, the tiredness, etc., etc., etc.? The list goes on and endless. Can we experience that, even though we are not bleeding?
Yes, very true. What the question is very true. Every month, the women, even though she's not seeing her bleeding, the hormones can play a big role. She can experience all the symptoms of having her period. The mood swings, the irritation, the breast heaviness, the cramps, except that she wants to see her bleeding and it is not happening. And this stays for about 8 months to 1 year. And once she crosses this menopause with huge family moral support, then she can just divert herself into other activities and slowly the hormones will become null.
Doctor, I think we're about to wrap things up for this morning. So one last question. What are some of the treatments available for this condition that we are talking about today?
All right. This condition of heavy menstrual bleeding begins with checking her blood levels for anemia. And if she is found to be anemic, then correct the anemia. Number 2, she needs to go for an ultrasound. When in ultrasound, then if the gynae can see a problem inside her like a polyp or a fibroid or her uterus that is enlarged, then the lady condition la santé est compliquée.
Oh, very complicated?
Yes. Okay. Very complicated. And then the treatment is entirely different. And the third, you can see the ovaries, and if the ovaries are polycystic, having small cysts, and that also changes her hormone and can result in heavy menstrual bleeding. And the last one, not to forget, it is always the cancer that has to be aware of. We should be aware of cancer, cervix, cervical cancer or uterine cancer that can cause heavy menstrual bleeding. So, the test or a biopsy, a tissue taken from the cervix or from the uterus, when studied, it reveals the earlier the diagnosis, the better the treatment. So, if she comes early, then the problem is solved. It is always better, at least early, than late and landing up in serious issue.
But a question, are you planning on coming to Prala anytime soon? Thank you for the question.
I wish to.
I knew that was coming.
I wish to come to Prali and not take months at least. I wish it happens one day.
Yes.
I wish to.
Hopefully it will happen. Doctor, thank you for this morning. Thank you for all the answers that you've given. And of course, we can always do this once again next time and have more questions from the ladies as well. What is the number to call for them to be able to have an appointment?
Yes. See, I'm visiting Dr. Murthy's.
Yes.
And I come every month, and they can call me at 2750 999 for appointment.
Yes.
And we do every kind of investigation there. And if possible, I can treat them spot on there. And I always educate them, please, to all ladies out there, please maintain a menstrual calendar.
It's important, isn't it?
It's very important.
And you have it on your smartphone. There are so many kinds of different apps that you can use.
Exactly.
Yeah. Even though I don't practice it as often as I should. Yes. I don't think mine is updated. I need to sit down and update it. But it is important. Il y en a nos téléphones, nos smartphones. Il y en a une app qui nous capable garder nos records, nos périodes. Et aussi important, mesdames et messieurs, il donne nous tout bon détail qui nous fait les sexual activities, etc. How often you drink your water, and so forth, qui fait qui nous capable garder record, qui si nous allons voir doctor, nous capable de faire l'information et il est important pour nous de faire l'information. It does help when you have the information, doesn't it?
Yes.
Yes.
Please, all of you, take care of your health.
Yes.
Follow your menstrual calendar. Eat healthy. Not pale alcohol. And
Doctor.
not pale alcohol.
Let's just say minimum.
Minimum. Go for red wine. And that's good for
red wine.
Yes, good for heart.
Oh.
And it just got at least good things happening inside.
Okay.
You can
1/3 of a glass, please.
Yes.
Not a full glass.
Yes.
This is how you drink your wine. Not.
And please visit the gynae.
Yes.
And I'm here until Saturday.
Yes.
And even on the public holiday, we are working.
On Friday.
Yes,
So
on Friday.
okay.
And the women can reach me out for any number of problems or any number of doubts they have. I'm here to clear.
Yeah.
And mope vini sesal novem lebensek.
Ou peut venir c'est novembre le 25.
Le 25.
Ça veut dire ou capable call mettre appointment si ou pas gain sans pouvoir aller là. Call bien bonnet là aujourd'hui. Mets appointment pour novembre le 25. Doctor pour là, il y a gain sans pouvoir. Doctor, are you planning on coming longer next time?
Yes, every month I'm planning to make it longer, from 7 days to 10 days. This time I'm here for 10 days. Maybe next time we can work on it. And because there are a lot of patients with a lot of problems, so Dr. Murthy's, I can see that. And so I want to help, I want to educate more than that. So I can create some awareness. So definitely.
Thank you for coming, Doctor. Thank you for spending your time with us and helping the ladies, and thank you for giving the information. It was absolutely lovely. The ladies, I'm sure they're dying to have more information, and of course, next time when you come, we'll see you again and we'll address another condition that we can talk about to help the ladies at home. On this note, mesdames et messieurs, voilà nos conditions que nous proposons là aujourd'hui au matin. Et si moi pareil, docteur, dit, what's the number again one last time, doctor?
2750
Voilà.
You can see me at Dr. Murthy's.
Dr.
And thank you, Sylvie. It was a nice interview. And this is Dr. Suganya Saravanakumar signing off. I'm from Sugan Hospitals, Chennai, Sugan Hospital, India. And I will be seeing you soon. Mo wawu biato.
Well, there you go. Mon pas besoin de faire les extra. Une fini faire ces affaires. Alors, le sanot, mesdames et messieurs, ça c'est une Topik Konversasyon pour aujourd'hui.